Today we will learn Apis mellifica. So the sphere of action or the indications of Apis mellifica include urticaria. The first picture is of urticarias, and then second one is of exanthema. Also indicated in erysipelas inflammation. It is a very good drug for dropsical conditions. So dropsy is an excessive accumulation or retention of fluids into extracellular tissue or into the cavities. I've made a separate Insta video on causes of dropsy. You can see that. So dropsy, especially of eyes, eyelids, of lips, face, throat, larynx, ovaries. So the also of hydrothorax, which is lungs. Now also a good drug for kidneys, acute inflammation of kidneys and other parenchymatous tissues, infection of bladder, anasarca, so nephritis and cystitis, retention of urine in newborn, and albuminuria. In female reproductive system, it is a good drug indicated in ovarian tumors, ovarian cyst, tumors or open cancer of mammary, abortion during early months, dropsy in later parts of pregnancy with puerperal convulsion, and mania in women from sexual excesses or suppressed menses. Also a good drug on various eye conditions, including keratitis, which is the inflammation of cornea, with intense chemosis, which is a swelling of this conjunctiva, which is shown in the picture. Staphyloma of cornea following suppurative inflammation. Styes also prevents their recurrence. Squint, myopia, and perforating corneal ulcer. Other indications include, as we saw, serous inflammation, serous membrane inflammation. So cavities का जो membrane है, that is serous membrane with effusion. So membranes of brain, heart, pleuritic effusion. It also indicated in infections, hydrocephalus, angina, insufficiency of mitral valves, organic heart disease, diphtheria, vascular goiter, peritonitis, thrombosis, lymphangitis, scarlatinal otitis, measles, cancer of the tongue, paralysis of right side with right eye closed. The indications of each of these conditions is given in the slides. So we know it is prepared from the poison of the honeybee. Now it is adapted to stumous constitution, glands enlarged, indurated, serous or open cancer. Now stumous constitution is a hereditary predisposition to glandular swelling, chronic infection and weakness most commonly associated with tuberculosis. So uh, women, especially widows, children, and girls who, though generally careful, become awkward and let things fall while handling them. Constitution or temperament is irritable and nervous and fidgety, and the patients are hard to please. Ailments from include ill effects of grief, fright, rage, jealousy, hearing bad news, mental shock, and suppressed eruptions. Now, bad effects of acute exanthema. We saw it in the previous slide. Exanthema, how does it look? So bad effects of acute exanthema, imperfectly developed or suppressed. So when they suppress it or when it is imperfectly developed, and that causes other ailments. Measles, scarlatina, and urticaria. Sphere of action we already saw. It also includes right side, and symptoms go from right to left. Now the type of pains, which is one of the key indication for EPIS, is burning, stinging, smarting. So they are the burning pains with swelling, and they develop rapidly. The pace of EPIS is very fast, and that extort cries. Patient cries, sudden shrill cries. It's unpleasant sound, which is crying sound, which is there in EPIS, in hydrocephalus and in meningitis. Also, there are itching pains. So these are the pains, which is one of the key indication for APIS. Now, aggravation right-sided, then right side, heat of the room, weather or fire, hot drinks, a hot bath, hot in the heat of the bed, touch, even of the hair, so heat is aggravation, touch is aggravation, pressure is aggravation, after sleep, lying down, suppressed eruption as we saw. 4 p.m. there is aggravation from getting wet, but better from washing or moistening the part in cold water. it is a hot remedy, so aggravation from heat and amelioration from cold. So or other amelioration factors are in open air, cool bathing, uncovering, slight expectoration motion, sitting erect, cold water and cold bathing, and pains are uncovering and pains better by coughing, walking, or changing the position. Now, the observation of AP's patient will be that there will be waxy pallor on the face or in the inflammation or edema of the part, shiny red rosy color. It will be a shiny, it will be a red rosy appearance. Cheeks hang down, eyes will be puffy, especially the lower eyelids, swollen red and edematous. Then face would be red, hot, swollen, edematous. Lips will be bluish, and upper lip is swollen. Edematous upper lip. Expression would be happy or terror-stricken or apathetic. Jaws stiff with stiffness of the tongue because it is a good drug for cancer tongue also. And paralysis of the right side with the right eye closed. Desire for washing face with cold water, formication and pricking in the face. So it is belongs to animal kingdom and it covers all four miasm. It is a hot remedy with tongue fiery red. You know, there is a fiery red tongue, swollen, sore and raw with vesicles. So redness, swelling and heat runs through and through epis. Aggravation 4 p.m. Thirst. It is a thirstless drug. All throughout all complaints, the patient is thirstless except during chill and craving for sour things for milk, which is makes him feel better. Child nurses by day and refuses at night, and side affection is right side. Now we will see the general indication of herpes mellifica. So inflammation with effusion. So in the cellular tissue also it will cause inflammation with effusion. So collection of the fluid, and serous membrane also it will cause inflammation with effusion. Now few things will be repeated, but it will be a revision also, and it will make us understand the importance of these symptoms also. So swelling or puffing of various parts. कैसा appearance रहेगा? Shiny red rosy hue and bag like swelling under the eyelids and of the hands and feet and dropsy without thirst. Now, intolerance of heat and slightest touch. Patient cannot allow you to even touch you, as well as there is slightest heat also patient will not be able to tolerate. Extreme sensitiveness to touch and general bruised soreness is marked. Pains are sudden that extort cries. Sudden shrill piercing screams from children while waking or sleeping. Pains are burning, stinging, smarting, pricking, and the burning is like hot needles. There is great debility as if he had worked hard and is compelled to lie down. Great prostration even to faintness. Symptoms develop rapidly. See, suddenly, there is a sudden appearance of the symptoms, and this progress also is very fast. Now, right-sided affected more, then symptoms go from right to left. Thirstlessness in anasarca, ascites, and great restlessness and fidgetiness. Tongue is fiery red, swollen, sore, and raw with vesicles. Now, sudden shrill cries in hydrocephalus and meningitis. So, ये सारे symptoms है when there is a hydrocephalus or meningitis, great restlessness and fidgetiness, trembling, jerking, and twitching, one half of the body twitching, the other lame or paralyzed, and neuralgia of the lips, tongue, and gums. So as we saw, there's inflammation, there is fluid collection, there is edema, which is of a shiny red rosy color. There is intolerance of heat and touch. The pains are sudden. The symptoms grow rapidly. There's debility, wants to lie down. It is a right-sided drug with thirstlessness accompanying, and patient is better by cold, along with tongue, which is fiery red. Now, Apis mind. Now, Apis belongs to animal kingdom. So, few symptoms which are of animal kingdom include jealousy, fright, jealousy with lewd talk, and suspiciousness, foolishly suspicious. So, the symptoms combination is there. So, jealousy, fright, rage, vexation, and grief. Jealousy with lewd talk, jealous, fidgety, and hard to please. You know, patient kitna bhi hum bolenge, he will not, you know, be pleased. Now, great tearfulness. See, Epi says weeping tendency, weeping disposition. See, so great tearfulness cannot help crying, weeps day and night without cause. Patient will say कि कुछ भी कारण नहीं होता है, वैसे ही रोना आ जाता है मुझे. Apathy, indifference, and unconsciousness says nothing ails him. Weeping disposition cannot help crying, discouraged and despondent. Now, listless cannot think clearly, hysterical girls at puberty, and fruitless activity, cannot concentrate mind on anything, attempting to read or write or study, cannot concentrate the mind. So these are the levels at which the nervous system is affected and episis indicated. Cannot bear to be left alone, sensation of dying, premonition of death, borrows trouble about everything, nothing seems to satisfy, all wrong and out of place. So this will be the feeling of the patient, and he thinks that everything is wrong and everything is out of place. He's not happy with anything, and no matter anybody does anything to him to please him or her, he's not agreeing to it. So hard to please. Fear of being poisoned, as we saw. Suspiciousness, there's also fear of being poisoned. Stupor with sudden sharp cries and starting, stupors alternating with erotic mania. Awkward, drops things readily and laughs either due to nervousness or due to absent-mindedness. Patient laughs because of various reasons. In EPIS, it is due to nervousness or absent-mindedness. Childish, silly behavior in women after delivery. Childish, irritable, excitable, jealous, fussy, and fidgety or apathic. These are one-line symptoms they give in one line, which I have added in my slide. Sudden shrill piercing screams, whining, tearfulness, constant whining in children, frivolous, which means not having any serious purpose or value, and cheerful. Now, these are eh, mm, the condition-wise symptoms. So, when there is a patient who is coming with exanthema, urticaria, or erysipelas, inflammation, or carbuncles, or lymphangitis, or thrombosis, we have to go for general indication, which is all what we saw, where there is a sudden symptoms develop suddenly, symptoms rapidly, pace is very rapid, there's intense burning, and then intolerance to heat and touch, better by cold, and then there is tongue. So all those classical presentation would be there in all patients with these conditions. Now in dropsy or dropsical effusion, edema of eyelids, serious inflammation, ये सारे conditions में there will be swelling and puffing of various parts. Again, we saw the edema would be red, rosy hue with burning, stinging pain, soreness, intolerance of heat and slightest touch, and afternoon aggravation. The limbs will become heavy, immovable. Patient will not be able to move. वो easily जो हम move कर रहे, patient will not be able to move. Immovable, heavy, numb, feet numb and stiff, leg and feet waxy, pale, swollen, edematous. See the limbs immovable, heavy, and numb. Now, inflammation of kidneys, bladder, anasarca, acute inflammation of kidneys and other parenchymal tissues, cystitis, retention of urine, albuminuria and strangury. ये सारे कंडीशन से वहां पे एपिस इंडिकेटेड है. तो सिम्टम्स क्या क्या है? Intolerance, incontinence of urine with great irritation of the parts, can scarcely retain the urine for a moment, and when passed scalds severely. Burning, intense burning रहता है जब यूरिन पास होता है. वो यूरिन को रिटेन नहीं कर सकता है इवन फॉर अ सेकेंड, और वहां का वो बहुत इरिटेटेड लगता है उसको वो सारे पार्ट में. यूरिन इज स्कैंटी, फाउल, high colored, and last drop burns and smart. Milky in hydrocephalus. So ये सारे condition है. Urine profuse more than he drinks, and he drinks little. Suppressed, loaded. Most of the conditions are associated with suppressed urine. So suppressed, loaded with cast, frequent and involuntary, stinging pain, scanty, high colored. Coffee ground sediment, and incontinence of urine worse at night and when coughing. So these are the conditions, specific indications for urinary system. Now it is a good drug for ovarian tumors, cancer of mammary, and ovarian cyst. Also other conditions we already have read in the first slide. So what are the indications? So right-sided indication, as we know. Then there is dyspnea with scanty discharge of slimy blood और with severe ovarian pains. So उसको वो ovarian region पे उसको दोनों sides पे pain रहेगा, especially more on the right side. And this pain in the ovaries will be worse during coition. Whenever she is having a sexual relation, that time the pain in the ovaries will be worse. Edema of the labia, which is relieved by cold water. Leukorrhea would be profuse, acrid, and grave. Now, great tenderness over the abdomen and uterine region. So, touch and tenderness, we already know patient is aggravated. Sense of tightness, the peritonitis may be aega. Bearing down as if menses were to appear. And the type of pains are stinging, burning pains all over. See, we saw it is a good drug for ovarian tumors and tumors of the mammary gland. Now, it's also good drug for cancer of the tongue. So, what happens is symptoms are when there is a cancer of the tongue. So, mouth is glossy as if varnished, tongue hangs out and cannot be protruded. That could be advanced pathology. Tongue feels scalded, red, hot, and trembling, and there is sudden involuntary biting of the teeth together. The gums are swollen, lips are swollen, especially the upper one, and membrane of the mouth and throat glossy as if varnished, and red, shining, and puffy, like erysipelas. So it is a red mouth or tongue, and when the patient grinds the teeth. So this we will take it up in our daily reading sessions. You can go through it. So this is all about Apis mellifica. I hope it helps. Please like the video and subscribe.